I want to tell our viewers about a recent outbreak of meningitis. Don't mean to scare anybody, but this is really important information that you all really should know. Hit pretty close to home too in November, so a little bit earlier in this year. An 18-year-old student who was also a lacrosse player at UC Santa Barbara unfortunately had to have his feet amputated after the infection spread within the body. Here to shed some light on this very dangerous infection is Dr. Richard Smith from the Tri-City Medical Center. Doctor, thank you so much for being here.
My pleasure.
Okay, so I think as a parent of four, I should know what meningitis is, but very frankly, I don't. I assume that many people are watching are saying, I've heard of meningitis, I don't know what it is. Doctor, what is it?
Sure, it's the infection of the meninges, which is the outer layer that covers the brain. And it can present in very different ways. Bacterial meningitis, the topic of your interest and probably the viewer's interest, it's one of those meningitis, and it tends to be very severe.
How would someone run across, be infected by bacterial meningitis?
Well, it's easily spread. It's usually spread through the respiratory tract. So droplets, which are really small, tiny little particles of saliva. That's the main way that it spreads. And that's kissing, sharing utensils, speaking, coughing, sneezing. All
right, so it's that time of the year here where we're getting towards the end of the year and holiday time, weather changes and so on. People get sick, they cough, they sneeze. How do we prevent getting something like this when it's everywhere?
Sure. So one thing to keep in mind is coughing etiquette, which is basically.
Oh man, I am into the elbow.
Yes.
And when somebody's not into the elbow, I'm that guy who tells them, hey, come on, man.
Yes. So
coughing etiquette.
Coughing etiquette.
Okay.
You probably want to avoid crowded places, although realistically speaking,
it's hard this time of year.
Hard to do this time of year.
Yeah.
Those are the main ways how you can prevent the infection from taking place.
How would somebody know if their children, and by the way, maybe this isn't, I'm thinking about it as a parent. Is it just kids? Is it older folks? Is there an age group that would be more likely to be infected by this?
Yeah, there are some groups that are more susceptible, but everyone's at risk. The groups that are more susceptible to it are the real young neonates and the old.
Okay.
But this particular organism, the one that we're talking about at UC Santa Barbara, Neisseria meningitidis, that's the whole name of the organism, likes to infect in crowded areas. So military recruits, college students are at high risk.
Okay, so how would I know? And what would be some symptoms where I would say, this isn't a cold, this isn't a flu, this is more serious, and oh my goodness, I was watching Spotlight San Diego and I saw a doctor and he said it could be bacterial meningitis. How would I know?
Well, the symptoms of how patients present with meningitis varies, but more than often they report a terrible headache, neck stiffness, they're unable to flex the neck without any discomfort, photophobia, which means they can't stare into the light bothers them. And then you have other things such as fever, high fever, a rash that tends to be throughout the body with macules, which are spots that can be different colors, red, purple. Altered mental status, the patient just comes in because they're lethargic, they're not waking up.
All of this sounds very scary. Is this a potentially fatal issue, or is this something that can be easily fixed, frankly, through some medication?
Well, Neisseria meningitis can potentially be fatal. I mean, mortality.
Why would this young man have to have his feet amputated?
That's an unfortunate and terrible complication of severe disease. When the organism becomes attached to the oral mucosa, it can penetrate into the blood barrier, and then sets itself into the brain. And if it does that and becomes overwhelmed, and the patient becomes overwhelmingly infected, then blood pressure becomes an issue, and then they tend to have peripheral ischemia, meaning the distal areas, the hands, the feet, they don't get good blood supply.
The moral of the story is, I mean, it's the holiday time of the year. You're going to be in the malls. It's going to be crowded. You're going to maybe be at a football game, whatever the case may be. Be careful, number one, and always consult with your doctor. Happy holidays. Thank you so much for being here, and thanks for all the information. We really do appreciate it. Happy holidays.